The study of effects of drug on living system is called option A pharmacodynamics, pharmacokinetics, toxicology, therapeutics. The correct answer is option B pharmacodynamics. Pharmacodynamics explain what the drugs to the body, its mechanism and effects on cells or organs. The study of absorption, distribution, metabolism, excretion of drug is pharmacology, pharmacokinetics, pharmacy, therapeutics. The correct answer is option B pharmacokinetics. Pharmacokinetics define what the body does to the drug covering absorption, distribution, metabolism, excretion. First pass metabolism occurs mainly in the kidney, lungs, liver, skin. The correct answer is option C liver. Drugs absorbed from the gut go through the liver before entering systemic circulation, where they may be partially metabolized. Which route of drug administration avoid first pass metabolism? Option A oral, sublingual, rectal, intradermal. The correct answer is option B sublingual. Drug taken under the tongue enter directly into the systemic circulation through oral mucosa, bypassing the liver. The time taken for the plasma concentration of a drug to reduce by half is known as duration of action, off-life, bioavailability, clearance. The correct answer is option B off-life. Off-life indicates how long a drug stays active in the body and helps determine dosing frequency. Bioavailability refers to rate of absorption only, fraction of unchanged drug reaching systemic circulation, drug distribution, metabolic rate. The correct answer is option B fraction of unchanged drug reaching systemic circulation. Fraction of unchanged during reaching systemic circulation. Bioavailability measures the percentage of administered dose that actually reaches the blood in active form. The extent to which a drug binds to plasma protein effects is option A distribution, absorption, metabolism, excretion. The correct answer is option A distribution. Only free unbounded drugs are pharmacologically active. Protein binding limits their tissue availability. The main organ for drug metabolism is liver, kidney, lung, intestine. The correct answer is option A liver. The liver enzyme systems convert lipid soluble drugs into more water soluble metabolites for easier excretion. The term prodrug means inactive metabolite, inactive substance converted into active form in body, highly active form, toxic drug. The correct answer is option B. Inactive substance converted into active form in the body. Prodrugs are inactive compounds that become active after metabolic conversion. Example, codeine becomes morphine. Which route gives the most rapid onset of action? Intravenous, oral, subcutaneous, rectal. The correct answer is option A intravenous. IV injection delivers the drug directly into the bloodstream, providing immediate pharmacological effect. The rate and extent of absorption of a drug can be influenced by route of administration, lipid solubility of the drug, presence of food in the stomach, all of the above. The correct answer is option D, all of the above. Absorption is affected by route, used drug solubility, and food, which can delay or reduce drug absorption. The main site of drug absorption after oral administration is stomach, small intestine, large intestine, mouth. The correct answer is option B, small intestine. The small intestine has a large surface area and rich blood supply, allowing maximum absorption of most oral drugs. Drugs that are weak acids are best absorbed in stomach, small intestine, colon, lungs. The correct answer is option is stomach. Weak acids remain unionized in the acidic environment of the stomach, making them more lipid soluble and absorbable. The process by which drugs are eliminated from the body is called metabolism, distribution, excretion, absorption. The correct answer is option C, excretion. Excretion removes drugs and metabolites from the body mainly via kidneys, bile, and sweat. Which drug is mainly responsible for drug excretion? Liver, kidney, lungs, skin. The correct answer is option B, kidney. Kidneys filters and excrete water-soluble drug metabolites through urine. The ability of a drug to produce a maximum response is called potency, efficacy, bioavailability, selectivity. The correct answer is option B, efficacy. Efficacy measures the maximum therapeutic effect of a drug can produce regardless of dose. The concentration of drug required to produce 50% of its maximal effect is ED50, LD50, TD50, off-life. The correct answer is ED50. Effective dose 50% is used to compare the potencies of drugs. The safety of a drug is indicated by its potency ratio, therapeutic index, plasma concentration, bioavailability. The correct answer is therapeutic index. Therapeutic index compares the lethal dose to effective dose. Higher TI means safe drug. Higher therapeutic index means safer drug. The phenomenon where repeated drug use decreases its effect is called dependence, tolerance, addiction, resistance. The correct answer is option B, tolerance. Tolerance means reduced response after repeated doses requiring higher doses for the same effect. When one drug increases the action of another, it is called synergism, antagonism, potentiation, tachyphylaxis. The correct answer is option A, synergism. Synergism occurs when two drugs together produce a greater effect than when used alone. When one drug reduces or blocks the effect of another, it is called synergism, potentiation, antagonism, tolerance. The correct answer is option C, antagonism. Antagonism occurs when drug opposes the action of another at the receptor or physiological level. When undesirable or harmful effect of a drug is called side effect, adverse effect, toxic effect, therapeutic effect. The correct answer is option B, adverse effect. Adverse effect or side effect are unintended harmful reaction occurring at normal drug doses. A mild, predictable, unwanted effect of drug is called adverse effect, toxic effect, side effect, hypersensitivity. The correct answer is side effect. Side effects are known, often minor reactions that accompany the therapeutic action of a drug. The exaggerated response to a normal dose of drug due to genetic difference is called idiosyncrasy, allergy, tolerance, dependency. The correct answer is option A, idiosyncrasy. Idiosyncrasy is an abnormal, unpredictable reaction based on individual genetical makeup. A drug allergy is an example of pharmacological reaction, toxic reaction, immunological reaction, idiosyncratic reaction. The correct answer is option C, immunological reaction. Allergic reactions are immune-mediated hypersensitivity responses to the drugs. Drug dependence means desire to continue taking the drug, withdrawal symptoms on stopping, both A and B, none of these. The correct answer is option C, both A and B. Dependence involves craving for the drug and physical or psychological symptoms if stopped. The phenomenon where rapid tolerance develop after few doses is tolerance, tachyphylaxis, idiosyncrasy, drug resistance. The correct answer is option B, tachyphylaxis. Tachyphylaxis is an acute form of tolerance where repeated doses quickly lose effectiveness. Which of the following route has the slowest absorption? Intravenous, intramuscular, subcutaneous, oral. The correct answer is option D, oral. Oral route passes through the digestive tract and liver, leading to slower and variable absorption. The process of transformation of drugs into more water-soluble compound is called option absorption, distribution, metabolism, excretion. The correct answer is option C, metabolism. Metabolism mainly in the liver converts drugs into hydrophilic metabolites for elimination. Which of the following factors can increase drug metabolism? Liver enzyme induction, liver disease, enzyme inhibition, reduced blood flow. The correct answer is option A, liver enzyme induction. Enzyme induction by drugs like rifampicin increases metabolic enzyme activity, speeding up drug breakdown. The branch of pharmacology dealing with the use of drugs in treatment of disease is called pharmacodynamics, pharmacokinetics, pharmacotherapeutics, pharmacy. The correct answer is option C, pharmacotherapeutics. Pharmacotherapeutics focus on the clinical use of drugs for prevention and treatment of diseases. Which of the following terms refers to the amount of drug required to produce an effect? Efficacy, potency, bioavailability, tolerance. The correct answer is option B, potency. Potency indicates how much drug is needed to produce desired effect. More potent drugs act at lower doses. The volume of distribution of a drug is total body water, theoretical volume in when the drug is distributed, volume of plasma, extracellular fluid. The correct answer is option B, theoretical volume in which the drug is distributed. Volume of distribution shows the extent of drug distribution between plasma and body tissues. Which factor doesn't affect drug absorption? Solubility, blood flow, drug price, pH of medium. The correct answer is drug price. Absorption depends on physical and chemical factors, not on cost. The process of movement of drug from blood to the body tissues is called absorption, distribution, metabolism, excretion. The correct answer is option B, distribution. Distribution allows transport of drug molecules from circulation to target tissues. The inactive form of drug that becomes active when metabolism is option A, active drug, option B, prodrug, antagonist, partial agonist. The correct answer is option B, prodrug. Prodrug are converted into active forms by metabolic processes in the body. The capacity of drug to bind with the receptor is known as efficacy, affinity, potency, selectivity. The correct answer is option B, affinity. Affinity represents the strength of a drug receptor binding. Higher affinity means stronger interaction. Drugs that produce effect similar to natural substances are called antagonist, agonist, partial agonist, inhibitors. The correct answer is option B, agonist. Agonist bind to receptor and mimic the action of endogenous substances like hormones and neurotransmitters. Drugs that block or prevent the action of an agonist are called agonist, antagonist, partial agonist, inhibitors. The correct answer is option B, antagonist. Antagonists bind to receptors without activating them, thus block the effect of agonist. The receptor theory explains how drugs are metabolized, how drugs produce their effect, how drugs are excreted, how drugs are absorbed. The correct answer is option B, how drugs produce their effect. The receptor theory states that drugs act by binding to specific receptors to initiate a biological response. The smallest dose that produces a detectable effect is known as maximum dose, minimum effective dose, toxic dose, loading dose. The correct answer is option B, minimal effective dose. It is the lowest dose of a drug that begins to produce its intended therapeutic response. The dose given to achieve rapid therapeutic concentration is called maintenance dose, loading dose, toxic dose, minimum dose. The correct answer is option B, loading dose. A loading dose quickly raises plasma concentration to the desired therapeutic level. The regular dose given to the maintain drug levels in the body is loading dose, maintenance dose, toxic dose, minimum dose. The correct answer is option B, maintenance dose. Maintenance dose maintains steady therapeutic concentration after the loading dose. The study of toxic or poisonous effects of drug is called pharmacology, therapeutics, toxicology, clinical pharmacology. The correct answer is option C, toxicology. Toxicology deals with harmful or poisonous effects of chemicals and drugs on living organisms. The route of a drug administration used for the vaccines is oral, intramuscular, sublingual, rectal. The correct answer is option B, intramuscular. Most vaccines are given intramuscularly for better absorption and immune response. The term placebo refers to a drug with toxic effects, a harmless inactive substance used for comparison, a drug that increases effect of another, a strong sedative. The correct answer is option B, a harmless inactive substance used for comparison. A harmless inactive substance used for comparison. Phlebicos are used in clinical trials to compare psychological various pharmacological effects. A drug that produces sleep is known as analgesic, sedative, hypnotics, and antipyretic. The correct answer is option B, hypnotic. Hypnotics are drugs that induce sleep, while sedatives is only calm without sleep. Drugs used to relieve pain without loss of consciousness are called sedatives, analgesics, anesthetics, antipyretics. The correct answer is option B, analgesics. Analgesics relieves pain by acting on the central or peripheral nervous system without causing unconsciousness. The science of preparing and dispensing drugs is called pharmacognosy, pharmacy, pharmacology, pharmacodynamics. The correct answer is option B, pharmacy. Pharmacy involves formulation, preparation, and proper dispensing of drugs to patient. The study of drugs obtained from the natural sources like plants or animals is pharmacology, pharmacognosy, toxicology, biochemistry. The correct answer is pharmacognosy. Pharmacognosy focus on natural origin, extraction, and chemical properties of medicinal substances. The time taken for plasma concentration of a drug to reduce by half is called half-life. Duration of action, latent period, steady state. The correct answer is option A, half-life. Half-life is the time required for 50% of drug to be eliminated from the plasma. The organ mainly responsible for drug metabolism is kidney, liver, lungs, skin. The correct answer is option B, liver. The liver contains enzymes that converts drugs into more water-soluble metabolites for excretion. The organ primarily responsible for drug excretion is kidney, liver, lung, intestine. The correct answer is option A, kidney. Kidney filters drugs and metabolites into urine, playing the main role in elimination. The first pass metabolism occurs mainly in the lungs, liver, kidney, brain. The correct answer is option B, liver. After oral administration, many drugs are metabolized in the liver before reaching systemic circulation. Bioavailability means rate of drug absorption, fraction of administered dose reaching systemic circulation, drug concentration in liver, speed of metabolism, fraction of administered dose reaching systemic circulation is the correct answer. That is option B. Bioavailability represents the actual amount of active drug available to produce effect. Which route of administration avoids first pass metabolism? Oral, rectal, sublingual, intravenous. The correct answer is option D, intravenous. IV route delivers the drug directly to the systemic circulation, avoiding liver metabolism initially. The plasma protein that drugs bind to is globin, fibrinogen, albumin, myosin. The correct answer is option C, albumin. Albumin binds acidic and neutral drugs, affecting distribution and free drug levels. Which form of a drug crosses membrane easily? Ionized, non-ionized, lipid soluble, bound to plasma protein, water soluble. The correct answer is option B, non-ionized, lipid soluble. Lipid soluble, non-ionized forms diffuse through biological membranes more readily. The rate of drug elimination equals rate of administration at steady state, peak level, loading dose, toxic level. The correct answer is option B, steady state. Steady state plasma level occurs when input equals output during repeated dosing. Enzyme induction causes decreased metabolism, increased metabolism, enzyme inhibition, no change. The correct answer is option B, increased metabolism. Enzyme induces accelerate hepatic metabolism, lowering drug concentration and action. Enzyme inhibition result in faster elimination, slower metabolism, increased clearance, decreased plasma level. The correct answer is option B, slower metabolism. Inhibitor reduce enzyme activity leading to prolonged drug action and toxicity. The intensity of a drug effect depends mainly on drug potency, plasma concentration, route of administration, color of drug. The correct answer is option B, plasma concentration. Drug response is directly related to concentration at receptor site. The term tolerance means okay. The term tolerance means reduced response after repeated use, increased response after single dose, hypersensitivity reaction, adverse effect. The correct answer is option A, reduced response after repeated use. Tolerance develop when repeated doses produce lesser effect, requiring higher doses. Tachyphylaxis means immediate hypersensitivity, rapid development of tolerance, drug allergy, slow metabolism. The correct answer is option B, rapid development of tolerance. Rapid development of tolerance. Tachyphylaxis occur when response diminishes quickly after repeated short interval doses. Idiosyncrasy means normal response, genetically abnormal response, dose dependent reaction, expected effect. The correct answer is option B, genetically abnormal response. Genetically abnormal response. Idiosyncratic reactions are unpredictable and due to genetical differences. A drug allergy is a type of toxic reaction, immunological reaction, pharmacological action, enzyme induction. The correct answer is option B, immunological reaction. Drug allergy result from immune response to a drug or its metabolite. The measure of a drug safety is expressed as therapeutic drug, potency, half-life, efficacy. The correct answer is option A, therapeutic index. Therapeutic index is equal to lethal dose by divided by effective dose. Higher value means greater safety margin. Drug producing opposite action to another is called synergist, antagonist, addictive, potentiator. The correct answer is option B, antagonist. Antagonist block or reverse the action of agonist drugs. Synergism refers to one drug decreasing the effect of another, combined effect greater than individual effect, equal effects, no interaction. The correct answer is option B, combined effect greater than individual effect. Synergism occurs when two drugs together produce enhanced action. The addictive effect of a drug means sum of individual effects greater than sum, no effect, opposite action. The correct answer is option A, sum of individual effects. Addictive effect is equal to effect of A plus effect of B when both given together. Potentiation means decrease in action, increase of one drug action by another, equal action, no interaction. The correct answer is option B, increase of one drug action by another. Potentiation occurs when a normal inactive drug enhances another drug effect. Drug dependence means psychological or physical craving for a drug, adverse reaction, normal tolerance, withdrawal, relief only. The correct answer is option A, psychological or physical craving for drug. Dependence leads to compulsive use and withdrawal when stopped. The main purpose of a placebo in trials is to test honesty, measure psychological response, increase drug effect, prevent toxicity. The correct answer is option B, measure psychological response. Placebos help identify mental versus pharmacological components of improvement. The blood brain barrier restricts entry of lipid soluble drugs, water soluble drugs, alcohol, gases. The correct answer is option B, water soluble drugs. Only lipid soluble non ionized drugs cross easily into brain tissue. Biotransformation converts drugs into lipid soluble forms, more polar inactive forms, toxic forms only proteins. The correct answer is option B, more polar inactive forms. Metabolism generally makes drugs water soluble for renal elimination. The main enzyme system involved in metabolism is P450 microsomal enzyme system, lipase, protease, amylase. The correct answer is option A, P450 microsomal enzyme system. Cytochrome P450 enzyme oxidates many drugs in hepatic microsomes. The most reliable route for emergency drug administration is oral, intravenous, subcutaneous, rectal. The correct answer is option B, intravenous. IV route provides rapid, precise, and complete drug delivery in emergencies. Sublingual route is preferred because it acts solely. Avoid first pass metabolism is painful, causes irritation. The correct answer is option B, avoid first pass metabolism. Drug absorbed through oral mucosa directly enters systemic circulation. Then the best route for slow, prolonged drug action is IV, IM, depot, oral inhalation. The correct answer is option B, intramuscular depot. Depot preparations release drug gradually for long-term effect. Pharmacogenetic studies, drug interactions, genetic influence on drug exposure, chemical synthesis of drugs, and toxic doses. The correct answer is option B, genetic influence and drug responses. Pharmacogenetics explain variation in drug action due to genetic differences. Teratogenic drug means liver damage, birth defects, cancer, allergy. The correct answer is option B, birth defects. Teratogens interferes with fetal development, drug pregnancy. Drug interaction between tetracycline and milk is due to chelation with calcium, enzyme induction, protein binding, ionization. The correct answer is option B, chelation with calcium. Calcium in milk binds tetracycline, reducing its absorption. The unit used to express drug potency in biological assays is option A, milligram, international unit, gram, mole. The correct answer is option B, international unit. IU measures biological activity rather than weight of drug. The cumulative effect occurs when drug is rapidly excreted. Repeated doses accumulate faster than elimination. Single dose only drug neutralizes. The correct answer is option B. Repeated doses accumulate faster than elimination. Accumulation causes gradual increase in drug concentration and toxicity. Drug antagonism can be of how many main types? How many main types? Option A 2, 3, 4, 5. The correct answer is option C 4. Major types: chemical, physiological, pharmacokinetic, and receptor antagonism. The process of drug removal from the body is absorption, distribution, metabolism, excretion. The correct answer is option D, excretion. Excretion elements unchanged drugs and metabolites through urine, bile, etc. The concept of receptor was first proposed by Langley, Paul Ehrlich, Clark, Dale. The correct answer is option B, Paul. Ehrlich proposed the side chain theory, introducing the idea of receptors. Desensitization means increased receptor activity, decrease in response after continuous exposure, new receptor formation, potentiation. The correct answer is option B, decreased in response after continuous exposure. Continuous stimulation makes receptors less responsive to drug. The ceiling effect refers to maximum possible drug effect, minimum dose, onset of action, toxic dose. The correct answer is option A, maximum possible drug effect. Beyond ceiling dose, increasing dose produces no further therapeutic benefit. Bioequivalent drugs have same rate and extent of absorption, different chemical form, same color, different efficacy. The correct answer is option A, same rate and extent of absorption. Bioequivalence ensures two formulations produce comparable plasma levels. Controlled release formulations are designed to shorten duration, prolong drug action, increase toxicity, speed absorption. The correct answer is option B, prolonged drug action. These formulations release drug slowly to maintain constant therapeutic levels. The fraction of drug unbound to plasma protein is inactive, active, excreted only, stored. The correct answer is option B, active. Only unbounded free drug can cross membranes and act on receptors. The study of dosage form design is pharmaceutics, pharmacology, toxicology, biochemistry. The correct answer is option A, pharmaceutics. Pharmaceutics deals with preparation and stability of dosage form. The pH at which drug exceeds 50% ionized and 50% unionized is option A, pKa, option B, pH 7, option D, log P, option D, off life. The correct answer is option A, pKa. pKa is a characteristic constant indicating ionization equilibrium of a drug. Placebo effect is an example of pharmacodynamic action, psychological response, toxic reaction, allergic effect. The correct answer is option B, psychological response. Improvement due to patient belief rather than actual pharmacological action. The steady state concentration is reached after 1 off life, 3 to 5 off lives, 10 minutes single dose. The correct answer is option B, 3 to 5 off lives. Repeated dosing achieves stable plasma level after about 4 off lives. Drug acting on same receptors but producing less response are full agonist, partial agonist, antagonist, inverse agonist. The correct answer is option B, partial agonist. Partial agonists activate receptors but with submaximal effect even at full occupancy. Inverse agonist produces opposite effect to agonist, same effect, additive effect, no effect. The correct answer is option A, opposite effect to agonist. Inverse agonist stabilize receptors in an active form, reversing agonist activity. The most common mechanism of drug absorption from intestine is passive diffusion, active transport, pinocytosis, filtration. The correct answer is option A, passive diffusion. Most drugs are absorbed down concentration gradient without energy use. The drug receptor bond that is weakest is covalent ionic hydrogen van der Waals. The correct answer is option D, van der Waals. Van der Waals forces are weak Short range attractions between molecules.